Namaste and greetings. I, GBAT, researcher and assistant editor at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi, extend my warmest welcome to you all to IMPRI #Web Policy Talk. In light of the budget presentation on the 1st of February, we are gathered today for a special panel discussion on population, health, and union budget 2022-23 as a part of the State of Population and Development #Population and Development series. This event is organized by the Center for Human Dignity and Development, IMPRI, Impact and Policy Research Institute, New Delhi. Now, let me take this moment to introduce the gathering. As the chair of today's discussion, we are privileged to have with us Mr. Devender Singh. He is with the Global Studies Program of the University of Freiburg, Germany, and also a visiting senior fellow of IMPRI. We welcome you, sir. As our esteemed panelists, we have Mr. Sandeep Chachra, the Executive Director of ActionAid India. We feel honored to have you with us, sir. Welcome to the session. We are delighted to have with us Professor Sanghmitra Sheel Acharya, a professor, Center of Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi. We welcome you, ma'am. We are pleased to be joined by Dr. Shobha Suri. She is a Senior Fellow, Health Initiative, Observe Research Foundation, New Delhi. We welcome you, ma'am. We also have with us Ms. Urvashi Prasad, the Director of Development Monitoring and Evaluation Office, Niti Aayog. We are honored to have you with us, ma'am. Welcome to the session. Lastly, we are glad to have with us Professor Pradeep K. Panda, who is the Professor and Dean of School of Public Health, Asian Institute of Public Health, University, Bhubaneswar. We welcome you, sir. Now I invite our chair, Mr. Devender Singh, to initiate the discussion with his opening remarks. We look forward to learning from our esteemed gathering. Thank you.
Thank you very much. I again welcome all the panelists, very distinguished panel we have today. And we are discussing a very important topic also, which is health in the 2022-23 budget. Generally, budget is a good occasion to see programs and the past year's experience in terms of what we had planned, how much we were able to accomplish in terms of not only the money sense, like what were the allocations and what were the expenditure, but also what were the targets, milestones, and whether we were able to achieve or not. But in recent times, since we don't have these 5-year plans by the Planning Commission, budget is also viewed as some sort of a vision document. And more we are seeing that long-term plans and long-term schemes and programs are integrated within the budget document. That's also a good way of knowing what, as per the government of the day, what are the priorities of the country. So in this panel discussion, what we have designed that overall we will start with each panelist overall statement, how they view the budget in terms of health and related sectors. But also what are the long-term vision they see in this budget and whether they see any such vision or not. Second thing, we also, because we have analysts who are engaged in the health sector for a long time, what are the needs as per different evidences we have, like National Survey or other reports, what are the needs which should have been addressed in this budget, and to what extent those needs have been addressed. Then we will also discuss what are the things which they think were promised in last year's budget, whether they have been taken forward, what is the progress on those programs and schemes which has been achieved, and in terms of what were the outlays, what were the expenditure, but also milestone and objectives of different schemes. And then in the end, we will just ask what could have been done, whether they are satisfied with the budget. Are there certain areas which glaring kind of gaps in the health programming which should have been addressed in this budget. The allocations which have been made overall for the budget are for specific segments like health or health system strengthening, workforce. What is the status of that? We will take the views of the panelists in the end of the panel discussion, and then we will end, depending on the time available are left, with my concluding thoughts. So we will start. I don't have any particular order how we start, but any panelist can start with the opening statement of how they view the overall budget. I would request that, because we want to finish this panel discussion within time limits, so please keep in mind that you stick to the time limit so that we are able to hear all the panelists on all the topics which I just mentioned.
But please choose someone.
We can start with, I can see the first photograph, Professor Acharya. We can start with her. The honors of starting the discussion lies on you, ma'am.
Okay, fine. That's I thought that's how you've listed me also. First of all, I appreciate the initiative that IMPRI has taken, and you particularly coming on board to kind of steer this discussion. In fact, a very important discussion, particularly in the light of budget. All the more when we've seen how COVID has behaved in last 2 years particularly, and affected almost all of us in various different ways. So if we really want to kind of argue what has budget in store for health, I think we do need to look back in past 2 years particularly. Now, very quickly, I'm sure we've all have had a glance on the budget that we've just kind of seen. The financial year, the forthcoming financial year seemingly has kind of given, or it suggests about 16% hike in the health sector allocation from the outlay, which was 82,000 crores. Is almost equal to the last year's outlay, and therefore the spending also seemingly has kind of increased. But what is very important to note in this budget, I would say that unlike last year, this year we have zero allocation for emergency response fund on the assumption, therefore, that the pandemic has kind of started to retreat. Now, this is something which I would think needs some kind of caution, because we are still not sure, as much as I would depend on literature and garner from there, we're still not sure what is happening in terms of the situation that COVID will unfold in coming weeks and coming months, therefore. So I feel that budget vision, if I may use that word, has been a little too optimistic. because the two important social sectors, I mean, if I can bring in education here right away, both education allocation for by center and the state has remained static at about 3.1% of the GDP, while health, like I said, has been increased by 2.1% from 1.8% in the year previous. So even while we say that the pandemic has affected all all spheres of life, health sector for sure was the worst hit, because the kind of emphasis which was there in terms of the need for health is kind of overwhelming. So expenditure on health sector, although increased from 2.73 lakh crores, which was in 2019 pre-COVID year, it kind of enhanced to 4.72 lakh crores in the COVID year, roughly about 73% increase, if one might want to get a sense of it. But then when we see between the last year and this year, the apprehension, or rather optimism, that it has started to recede needs some kind of caution, all the more because this is where much of the development sector rests. So if we are trying to put both the two sectors, social sector together, and I would want to bring in education right away here, because health education, for instance, is an important constituent of the larger health sector in that sense. So while the spending on these two sectors during the pandemic year was something to the tune of 8.65 of the GDP, in the current fiscal year, it seems there has been some kind of variation over there. And therefore, I would reiterate that the sense that we've been getting, or we've been trying to suggest as scholars or as interested people, those of us who are interested in the area of health, the need to increase the budgetary allocation for health sector perhaps becomes extremely, extremely important. The other point which I would quickly want to add in over here is the very idea of generation of data and its utilization. While we have lots of data which has come up on COVID morbidity, mortality, vaccination, but a lot of it still remains unused, particularly for any kind of comparative analysis across regions, social groups, social classes, caste and ethnic groups. And therefore, I think the state, over and above, like you said, budget really has been shaped into a vision document, although we might want to differ in our ideas whether budget should be labeled or considered as a vision document. Nevertheless, the idea that data is there, but data processing, data access, data availability becomes very, very important to be able to do any kind of planning for what may happen in future. And I'm sure we get that sense right from the National Health Policy from 2017 itself. Therefore, I think a 10% hike, which was kind of during the COVID-19 year, perhaps as many of us who work in the field of health feel is not going to be enough. There is a need to reconsider this kind of consideration, and I would think that's my take on your first query, that the point that you've made. I'll stop here. Thank you so much, Professor Singh.
Thank you very much. We can go to the next panelist.
Right. So,
Sandeep ji, yes.
Is that the order, right? I'm happy
Yes.
to go. If not, I can wait. So, okay.
Sure. No, please.
First of all, at the outset, let me thank colleagues from IMPRI for hosting this timely webinar. We've just had the budget, and here we have this discussion on one of the most important topical issues given the last 2 years. Quick first starting points. What do I welcome in this budget? The fact that mental health has been emphasized is extremely important. Of course, it's telemedicine centers, and I think that, but nevertheless, that recognition is important. It has been a silent, very silent killer, and I'm glad that COVID has exposed and the budget has taken the opportunity of highlighting the issue of mental health and putting some money into it. I mean, we can always debate how much and how little, but that's welcome. I think also welcome is this national digital database on health facilities across the country that will help in the long run. Once again, how much, how less, it's a good starting point. So these are very welcome steps. I find them fresh. I find them in the right direction and the right path. Much more debate, of course, is needed. How do we sort of go ahead of this? Now, I want to come to some of the challenges and expectations that one would have had of the budget per se, but particularly on the health sector, since we're talking this. And I want to start by saying that health cannot be viewed in isolation, as Professor was saying earlier. And well-being and budget, to me, are the most central aspects in a time like this. See, we are coming from a pre-COVID economic slowdown, 2017, 2016, 2018. This is what the masses of this country, the large majorities of this country, the working people of this country had been deeply affected by. And all indicators you can take up prior to COVID, and you will find that economic slowdown has caused job losses, joblessness, unemployment. In fact, unemployment stands at a 50-year high, and COVID is not the only criminal for that. Yeah. So that's we coming from that. People have been battered by two waves of COVID, the large majorities of this country. In the first wave of COVID, the spectre was out on the streets. In the second wave of COVID, the spectre was out in the hospitals. So in a sense, we saw those two deep battering impacts, particularly on the large majorities which make up the working people of the country. Let's take the example of informal sector workers. So you saw the deep shocks that these two waves sent them back years. And now also, people have been battling periodic lockdowns, weekend curfews, night restrictions, although the third wave is plateauing. So one cannot sort of wish away the third wave and say it had no impact. It has had impact on costs, health costs, and so on and so forth. So this is what the scenario of the budget is. We know that joblessness, job losses, wage losses, contraction of work, quality of work, and wage, both, has been a cumulative impact. So it's all that I said. Now we look at the other data, and that's what I want to highlight here. If you look at the data which the economic survey released, and before that the CMI, is actually on the question of private consumption. I want to bring in private consumption. And if you go with the data, actually private consumption last year, 2021, has barely climbed up to actually 2017 levels. So 4 years back. So it's not still there, or it's around there. So yes, there was a spike in the end of 2020, but then again, we have a private consumption. Now, private consumption is a very, very good indicator, in my opinion. Not only is it around 58, 59% of the GDP, but it's a very good indicator of people's well-being, because you only spend in the market when you have some degree of ability to do so. Yeah, and private consumption in a depression means many, many, many things. I want to approach budget from the perspective of who is the protagonist in terms of where the budget goes. So if you look at private consumption data, we know it's depressed. We know it's not climbing up in a hurry. And we know the budget took one path, one correct path, at least on and that's something welcome, that yes, we will increase governmental public spending in terms of infrastructure. So we've had huge talk on that on all the media channels, in all the newspapers, that yes, this is a welcome step. Yes, increasing demand by investing governmental resources into public assets, provided they are not sort of channeled off to imports, subsidized imports, or provided they don't go into sectors where employment is not created. So there's always a trickle-down impact, but that trickle-down, I mean, the budget more or less has taken that theory of trickle-down impact. So yes, it will invest much more in private sector, much more in governmental spending, and therefore create a trickle-down employment effect, and therefore create a trickle-down well-being impact. Because the social sector budgets, as Professor was pointing out, whether it's education, whether it's health, have remained static or have reduced. Now, the other expectation, and I'll come to the other questions you raised, the other expectation was actually direct programs which go to the unequal part of India, which go to poor people directly, whether it's through direct employment programs, whether it's through subsidizing agriculture. In fact, agriculture has been a little bit disinvested from governmental spending in terms of, if you look at fertilizer cuts, the money spent on fertilizer. If you look at the MSP is actually also not really increased despite all the protests on the street, and we saw a lot of them. So in such a situation, we know the ability of people to spend on health is reduced. You know, one can always argue that, you know, if our health was public, quality and free, then one could argue, yeah, that's something buffered off, but it is not. Whether it's at the primary level, whether it's in countryside or whether it's in town, people have had to spend a lot of money on health and therefore compromise other needs. And that we know was always the case in India, that if you look at the household budget, health spending constituted a fair good part of it. And one can argue about what's the percentage. So it's not important for the moment, but I think deeper analysis should be done. So what's happened, if people have spent more money on health, if people have had lesser income, where is the contraction happening? The contraction, first of all, happens if you're a working class household. The contraction, first of all, happens in other items, such as food, such as rentals, such as, and these are all private consumption matters, such as your ability to buy soap or something else in the market, such as your ability to invest in your own welfare, that of your children's welfare. So in a situation like this, the expectation was, and there's a long-held expectation, I will not get into that and not repeat everything Professor has said, that as a percentage of the GDP, it's always been a debate. It's nothing new. There has been what is called incremental climb up. I remember in 2013-14, the figure was something like 1.15% of the GDP. By now, it has reached 2.1% of the GDP, or barely there. Yeah. So one can say it's increased, but it's far too low if you compare the situation of health in India. And this is a long neglected issue. It's not as if it happened in the last 2 years or 5 years. It's a long neglected issue. And if you compare it with countries which do well on health, it's nowhere near. Even the governmental idea that, or the health committee's idea that we would go to 2.5% by the year 2024, 25, I don't remember the exact year, but somewhere there, is not enough. So that's a separate debate. But if you now look at the figures of health, there was a lot of expectation that the health infrastructure of India, the primary healthcare level, NGOs like us work there. So the private healthcare centers, the community healthcare centers, the district healthcare sort of facilities, or even the state healthcare facilities will receive a boost. And this COVID, if it's done one thing among several other unmaskings, is the question of unmasked to the public eye the ramshackle condition of our public healthcare system. So the expectation was that at least with this COVID, and that the fact that last couple of years, you've seen raise in, particularly last year, you've seen a huge raise in the health expenditure because of this crisis, not COVID, because of the condition of the health infrastructure, and partly, of course, COVID. Much more long-term planning and thinking, a radar setting on how we need to pay much more attention would be reflected in the budget numbers. But sadly, if you look at it, the budget numbers today are, I think, 0.2% more than last year, the revised estimates of last year. So it isn't lesson learning. And again, the good thing that I'll come to that later. But again, if you see COVID planning, I mean, the government seems to have thought that COVID is behind us. 75% of our population is double vaccinated by the recent days, and one can take that figure. But you have non-adult population yet to be vaccinated, single or double dose. You have booster doses, third doses liability on you coming up for all those who have been vaccinated 9 months, 10 months ago, 7 months ago. So that has to be planned for. But the provisioning for vaccination, for example, which comes under the heading I wrote somewhere, which comes under the heading of public and medical health, is actually only 5,000 crores. Last year, the government spent 39,000 crores on public and medical health care, for which largely went for COVID vaccination. So in some ways, it seems to be that the message seems to be that COVID's behind us, and that I think it's not been adequately planned for. And one can always say government can put in supplementary budgets later on, but what's the point? Do it now. The fact remains that you have these liabilities of vaccination. You don't know if Omega, there's further mutations of the virus. So you need to sort of prepare yourself for that. The good thing, however, is in keeping that budget there, not growing it and not finding the new money, which we are criticizing, at least some redirection has been made by reducing vaccination budget. The redirection seems to have made into the infrastructure part, which is a welcome thing. I mean, it should have been with new money, ideally, but it's not with new money. It's just it's sort of within the static budget, you kind of move the money there, which is welcome anyway. But provided we should have planned for additional money and done the vaccination thing, it's moved into what is called the PM Abhim, the Prime Minister's Ayushman Bharat Health Infrastructure Mission. Now, a lot of that money actually goes to primary and secondary care centers within states and within locations. So I think that will be a sort of investment into future in terms of hopefully strengthening primary and secondary healthcare infrastructure, putting in place. We know what's the sort of status there. X-ray machines are not there. Doctors are even not there. Other kind of facilities, not major facilities of ventilators and things like weren't there. So I think at least that can be stabilized, but that's again not enough money. Now, the other point I want to make, the two other points, and I stop because of time. The one other point is there are outstanding health issues. And the one, I want to pick up 2 points there. One is about women and children. If you look at the National Family Planning, the Family Health Survey, NFHS data of NFHS 4 and NFHS 5, you see there are 2 big indicators there. The rise in levels of anemia among women, 4%, 5% in these 5 years between NFHS 4 and 5, and the rise in levels of anemia in children and undernutrition in children. So this again within those 2 NFHS 4 and 5. And that therefore means those things haven't got attention because you sort of have that same kitty of money available and you need to start those programs. One more thing, had you taken the same anemia, nutrition, other well-being data of the social diversities in India, of the various social diversities of the various quote unquote informal working classes of India, of which there are Adivasis, of which there are Dalits, of which there are denotified tribes. One can go to those things, of which there are also refugees. That's an exclusion. If you take all that, then you realize that there are lots more pending health issues which need priority addressing. We don't have that data. We have a general population data. The private consumption data, for example, I was giving is a generalized data. So it kind of masks what's the level of precarities of people who are really at minimum wage levels within that large chunk of an average what's called consumption data. So I think there are those outstanding issues of research, of what more investments are needed, of augmenting health planning, health extension, as well as resources in health, that I think that this budget has belied. The fear is, and I close here, and this is a fear, and I hope corrections can be done. The fear is in prioritizing a part of the budget that has been commented on, what might fall by the wayside are these long outstanding issues of health, of welfare, of well-being. Health and well-being are very deeply linked. They might fall by the wayside because we have chosen maybe a part of the correct way, but not fully. We have chosen a path which says that we will create infra, we will invest in public infra, we will create trickle-down economics, we will not increase wealth, we will not increase revenues by wealth taxes and super taxes on super rich or other kind of revenue generation mechanisms, increase the tax burdens on corporates. So as a result, if our resource kitty isn't growing, some of these issues, particularly health, which we are speaking about today, but many others like education, for instance, will continue to be static or would continue to be not fully and neededly invested into. Thank you.
Sorry, for a moment I lost the connection, but I was able to reconnect. Thank you very much, Sandeep, and you have very comprehensively, you have taken almost all the aspects of the budget now, and that gives me a good segue to go to Shobhaji, because he talked of data also, he talked of policy also, like what could have been the direction and what has been done. So on that, I want to hear what you think of the overall budget, and from the policy perspective also, what should have been done, what are the kind of long-term perspective on that, and what has been done, what could have been done.
Yeah, I'll begin with that. Thank you, Devendraji. And I quite agree with a few things which Professor Acharya and Sandeep ji have been talking about. And I do agree that health can't be seen in silos. And there is a need for a multi-sector planning and a vision in mind when you're looking at allocating budgets. And every year we do have a vision, we do have expectations, but then when finally the budget is out, then it sometimes seems that it is not evidence based. You know, you see what's happening, and a budget should be based on the ground reality. Anyway, having said that, I think overall, my view on the budget is, despite the pandemic, the health budgets does not seem to see much of an increase. And as Professor Acharya said, like 1.8 to 2.1, that's hardly an increase. And now they have also added the water and the sanitation outlay in the health budget. So where the allocation will go, that is again, an important thing to be thought about. And when we look at nutrition, which is a very important factor, which Sandeep ji mentioned, when we talk about anemia or malnutrition, the nutrition outlay has actually seen a decline, or it is static at some point, and at major points, it's seen a decline. So having said that, everybody has talked about the different aspects of health. I would like to focus on women and children health, because rightly so, when you say population and health, almost 48% is comprised by women, and they also add 18% to the GDP. So I think it's a very important sector to understand, and that also depends on the future of the country. Like when we say that adequate nutrition is critical not only for the women's health, but also for the health of their children. And there is enough evidence which is available that, investing in maternal and child health, it yields, almost a triple dividend, both, and it's not only in low, but also in the low and upper middle income countries. Having said that, if I have to talk about the budget 22-23, and if I look at the nutrition and the health, it is very disappointing, or I would say very disheartening, because it does not take into account the existing socio-economic reality. I totally agree to Professor Acharya when she said that there has been no allocation for emergency response. You are facing an emergency situation. There is a pandemic happening, and past 2 years you've had at a loss of lives and livelihoods. But still, there is no adequate, budget allocated to be looking into any of these emergencies which could arise. And poverty, hunger, anemia, malnutrition are all at high levels. If you see the latest data of NFHS 5 and compared to NFHS 4, it has not come down much, even if you look at stunting, rather wasting, everything has gone up. So I think it's all the more required to look at what is the reality, and then to be able to envisage a budget so that we can overcome the crisis. And when we talk about women specifically, the COVID crisis has, almost led to a double burden or a double brunt of both the economic as well as the social fallout. Just to give an example, when we talk about nutrition programs, there was one program which was launched in 2018, the Poshan Abhiyan. Then in the last year's budget, we saw that they launched the initiative of Mission Poshan 2.0, which was again on the delivery and strengthening the nutritional content. But here, when we see that the implementation of the initial program, which started in 2018, has been poor, so has been the other programs which cater to the supplementary nutrition or the Anganwadi services or the health services which are given at the Anganwadi center. All the beneficiaries have gone down. So, and when you see a decline in beneficiaries and the program not being implemented, there is no point into doing an initiative 2.0, and that too without any extra allocation. What needs to be done is strengthening of the program, implementation of the program, and just not allocation or mention of it. As rightly said by Sandeep ji, that mental health has been given its due, but how much due and how they are going to implement it, that is more important to see, rather than just having a mention of we are going to be having a budget for teleconsultation or for mental health. And the nutrition budgets have already been on the low, since last year, since the last budget. There has been a decline of almost 26 to 27% in terms of the nutrition program budgets. And now with merger of programs, merger of different missions like the Mission Shakti, the Mission Vatsalya, and the Mission Poshan 2.0, we actually don't know whether where the budgets are going to be slashed. One important good thing is they have Nari Shakti, the gender, they have kind of recognized in this budget, but there has been no extra allocation for that. So it's basically like neglecting the the vulnerable women, and especially against the expectation of a transformative opportunity. So I would like to say that as also mentioned in the budget speech, that 2 lakh Anganwadis are going to be upgraded, but with no allocation, with basic poor infrastructure, the budget seems more like a token service or a lip service, with not much emphasis being given. I mean, they need to take the socio-economic reality which is there, to have a vision, to have a plan, to be able to allocate, sufficient budget because this is the whole budget which is going to run through the whole year. So when earlier there is a deficit, I mean, you can't have the same budget when you're already facing a deficit. So I would like to end here saying that yes, there has been no planning, no vision in terms of when the budget seems to be laid out or discussed. I don't know what kind of evidence they take into mind before laying out the budget, but then definitely the ground realities have not been taken into account. Thank you.
So please unmute.
Thank you, Shobhaji. The last line is very telling, and that also leads me to Urvashi ji, because she is a health research expert. She has looked at the policies also, and now working very with the Niti Aayog, again looking at the data, evidence, and the milestone and the achievements. So, Urvashi ji, as a health expert and is working with the Niti Aayog, how do you view this the budget from the perspective of the health?
Yeah, thank you, Devendra. Just checking, can you hear me? Because I have a bad
Yes,
connection.
yes, we can
Okay.
hear.
Okay, great. So, so I think, firstly, thank you for having me here. This is really a fantastic panel and obviously a very, very important subject. So very glad to be here. I would agree with a lot of the points that have been made. So, I wouldn't necessarily repeat those, but just, speak to a few specific points myself. So I think firstly, from a health sector perspective, I think, there's just no doubt that, sort of any amount of increase that we look at, it really just never feels sufficient because it's been a chronically underfunded sector. It's like also one of the panelists was saying, it's not just 1 year, 2 years, 5 years, 10 years. It's really historically always been a sector where it's seen as, you sort of have to make room for expenditure here rather than truly seeing it as an investment in human capital. So I think, when I look at it from the public health lens, which is really my perspective and my training also, this has always been a very big challenge. And I think so this is something that definitely, there's no doubt that allocations for this sector and also related areas, because ultimately it's, also nutrition, it's water, it's sanitation, ultimately all of these go together. So I think that is something which is, indisputable. I think the whole, digital, we spoke about that. Yes, I think there is obviously a digital push in many areas that we are seeing. But in health, as we know, it can be an important enabler. It's no substitute for actual delivery of services. But yes, if it's implemented well, and that's what I always say, that, budget announcements are just that. Ultimately, the devil lies in the implementation, and much of that depends on how the whole center state, dynamic plays out. So I think that's something principally, it's welcome, it's good to see, but we'll obviously be able to see the impact once we get to the implementation stage. There's a couple of, other broader points, and, that might be going slightly beyond the ambit of just the union budget as well, but I think it's critical, especially when we talk of the social sectors. And I think one is the whole center state, as I said, that whole relationship, because in social sectors, states also play such a critical role. Center certainly does, but so do states. So whenever we sort of talk of these allocations, when we talk of expenditure, and we talk of implementation, I think it's so important that we, look more into how the whole center state relationship is playing out in all these areas. And where are those gaps and how can those be addressed? I think that is something that, especially for social sectors, where there's states have a very big say in what actually happens. I think that's very important. It's also very important because there's a lot of allocations which might be made, but then we often see that there is an expenditure issue. So while to us it might seem that these allocations are so small, why can't we spend at least this much? But then, there are so many issues, there are so many gaps, whether those are procedural, whether those are administrative, which actually often don't allow even that pot of money to be spent well. So I think in addition to just looking at these outlays and saying, okay, what got how much money, we do need to look much more systematically. And there is analysis which is done from time to time. There's a lot of researchers who work on this, but I think even from within the government, this sort of analysis, looking at it, very systematically is quite important, because this can actually then make the whole sort of budgeting exercise as well, and where that goes, much more meaningful. So I think that's the second point. And the last point I would really make is sort of something that we have been working on, and the organization I'm working with within NITI Aayog, which is the Development Monitoring and Evaluation Office, which is to say that we look much more strongly also at what is happening from these schemes. So you have an announcement, you have a new scheme launched, but really going beyond that to say what is tangibly being achieved in terms of outputs and outcomes, and how's that feeding back into the decisions we make regarding the allocations, the future allocations of these schemes, or their continuation or discontinuation. So of course, some people might be aware of it, that alongside the budget, we also have an outcome budget, which is being laid in Parliament for the last few years. And that's actually a document that we work on along with Department of Expenditure. So there's obviously a lot of work to be done on that to make sure that this exercise is truly meaningful. It's truly linked to the functioning, truly linked to the allocations. But I think it's an important mindset shift that we're trying to bring about through this, so that this whole exercise does not, just remain, at the level of talking about what we allocated to what, and which scheme and which initiative, but actually looking at what we tangibly achieved and what the gaps are there, and therefore how we need to reorient perhaps when we come to the next budget. So I think this is an area which is really very, very critical, and perhaps a lot more attention and a lot more work needs to go towards this as well. And that is something that we are trying to at least push from our side along with Department of Expenditure. So hopefully we'll see the results and greater results of this in the coming years as well. So I'll stop there. Thank you.
Thank you, Urvashi. Thank you very much for sharing your ideas, and also important thing on the outcome document. We come back to this. We would like to hear from you more on that, but first invite Professor Panda to share his views.
Thank you very much, Devender ji. Good afternoon, everyone. I'm grateful to the organizers for having me for this important webinar on health budget. Let me not repeat what my other panelists have talked about, but I'll just mention few welcome announcement and positive development in addition to whatever have been told. As everyone is saying that health is a multidimensional subject, there are some important social determinants focus in this budget. For example, provision of tap water, provision of housing, digital classroom for schools, emission-free transport, battery swapping facilities, incentives to reduce crop burning. So all these are very important social determinants, and that may be helpful to the health sector as well. Now, my take is that, as everyone is saying, I think the health budget is less than expected. So the first takeaway is that the historical tradition of according a low priority to the health sector has continued. The last 3 years were good. There was some continuous attention to the health sector. There is an increase in outlay, but that trend has been break now in this budget. So there is a lot of evidence on this, and already my colleagues have spoken about it. For example, public expenditure on health, both central and state governments combined, as a percentage of GDP, gross domestic product, was 1.4% during the pre-pandemic period, 2016 to 2019. It increased to 1.8% in 2020, first year of pandemic, and 2.1% last year, 2021, second year of pandemic. This year's health budget will be less than 2.1% of GDP if we adjust for growth and inflation. So there is a break in the trend. Hopefully it should have been continued with an enhanced focus. That has not happened. We can look at another indicator. What is the overall share of health expenditure as a percentage of total government expenditure in order to understand the priority according to the health sector? So it has sharply reduced. On the basis of last year's revised estimates, if we take into account all package due to COVID-19 vaccination, this percentage is 3.45%. On the basis of last year's revised estimate. If we exclude the COVID-19 vaccination package, then it comes to 2.37% last year. And if you take into account this year's budget, it has further come down to 2.26% in 2022-23. So public expenditure on health as a percent of GDP, as we know, was to be 2.5% according to the National Health Policy 2017. Even the World Health Organization is much more ambitious. It suggests even 5% for middle income countries, but we are less likely to achieve these targets anytime soon. Now, the second takeaway is that the actual allocation to the health sector in this year's budget has gone up only marginally as compared to the last year. The third takeaway is that public health does not seem to be a priority in this year's budget. What is the evidence? Already Sandeep ji talked about it, in fact. So last year's revised estimate on spending by the government on medical and public health was 74,820 crore. And this year's budget estimate is 41,011 crore. So this large reduction is due to reduced requirement of COVID-19 vaccination. Another issue is that the point to be noted is that this allocation of 41,011 crore for the medical and public health also comprise of other components. For example, establishment expenditure, central health schemes, and central health institutions. So there will be very little money left, in fact, for medical and public health, if you account for these. And the fourth takeaway is that because there is a stagnant budget allocation to health sector, so what is the implication? It means that the states have to shoulder the major responsibility to financing and delivery of healthcare. Thank you.
Thank you very much. Good evidence, good data, and by other panelists also, evidence on anemia, as Sandeep ji said, and Shobha also said. Professor Acharya mentioned the importance of research and evidence and doing continuous analysis of the data, not only in the pandemic time. So second, it has come out, but very briefly, I want to hear, are there, apart from anemia, nutrition, and importance of health research, are there any other ideas which should be also should have been looked into the budget? Our provision should have surveillance systems, which were emphasized in the last year, were they emphasized in this year's budget and allocation made or not? So do we have the wherewithal to where the epidemic and what kind of will help? Do we have the workforce, public health experts, not only at the national level, but at the state level, district level, assisting the government to know what could be the situation and what could be the response of the government at the local level, building from the local level to the higher level? That kind of, whether those systems thinking things which were mentioned in the last year budget, whether that took place in this budget or taken a rise of. Again, anybody who wants to jump in can come.
Let me just quickly, just one or two points, and then hear other speakers, but also maybe other questions are there. I think as follows. I think one of the questions which pandemic should be teaching us is how do you make a future which is reset, particularly on the health side we're talking today. But how do you do planning for future pandemic proofing, any kind of pandemic, yeah, or any kind of epidemic and things like. And I think that's something that I really didn't discover. That direction, that thinking, that allocation of resources, that I did discover in this budget. For instance, let's look at occupational health and safety. Now, on the labor side of things, the government has a code of occupational health and safety, which is now an act. And I think a big element of occupational health and safety goes into how do you make your workplaces sort of proof, if not proof, How do you make your workspaces a little secure from questions of occupational health, from questions of pandemic, what we call pandemic proofing, for instance. And that would mean, in simple terms, that would mean that for now we are using the word COVID appropriate norms. When informal workers work in quarries and mines, when informal workers are at construction work. So there's one part to it with reference to other aspects, which of course pertain to health or accidents and things like. So I think that other aspect which we could have done is missing in the budget. How do you make workplaces which are well ventilated, clear, appropriate distancing, follow particular norms, and that has a lot of liability on the employers and in turn the welfare state. So we seem to have not really invested in that, and that I think needs to be directed, could have been directed much more strongly in as much as the question of occupational health goes. And that focus can obtain from both the new act, but as well as the lessons we need to be learning from pandemics such as the COVID-19 one, with all its mutations and variations. The other bit with reference to health, and I think that some stage needs, and I mentioned this in the passing, but needs a much more sort of researched, sort of research-based allocation and financing too. It's a question of, see, a continental country like India, we need very active decentralized response mechanisms. And a cadre or a cadre of health workers responsive in that very, very quick response context. And the fact that with this kind of a diversity that we have, disease patterns, sort of genetic onset disease patterns. So there's a whole variation there. Yeah? And even if you take the standard items, such as anemia, such as I mentioned a few, a lot of these may not have been discovered. Let me take an instance. It is well expected that people who are at very critical, precarious survival levels, who haven't the adequate nutrition, which was pointed to here, will definitely would be suffering. It's not genetic at all. Would be suffering from health precarities of various kinds. Anemia is an example of that. Yeah? Why women suffer, why children suffer. It's because of nutrition. It's because largely they do not have the kind of input or intake that would secure them from the onset of such sort of harmful health conditions. In such a situation, a lot of the data is not there. So yes, we have data for women and in a very generalized way, or on some certain indicators, we have data. And I think the technology, and I am one which would say that best technology should be used for diagnostics. That technology should be used for preventive sort of things which can be dealt with. And that, I think, that element is not just research, it's the allocation that you do, it's the impetus that you give to such aspect to secure your populations. Is probably, I don't see that in the emphasis in the budget at all. And I think that's something we should be more and more emphasizing of, among other things.
Very rightly pointed out. I want to bring here Professor Acharya, because we are talking of capacities. So do we have the capacities in terms of research, in terms of analysis, in terms of proper response? And do we have that kind of trained workforce? Like when we do have enough epidemiologists, public health specialists, also people working, like for example, I'm very keen to understand bringing population dynamics and then preparing for any disaster or any health emergency. How many old people are there? How many pregnant women are there? And doing those population projections so that we prepare in advance. So Professor Acharya, you are associated with the teaching and training and writing on these areas. So do we give enough attention to these areas? Do we support organizations who are working in these areas? What needs to be done to have that kind of workforce in research, in public health, in service provision. Your views on that?
Thank you, Dr. Singh, for bringing me over here. I'd probably start with what has happened to the budget for health research. If I connect with last year's allocation, it was something to the tune of 2,600 crores, of which the expenditure went up to 3,000 plus crores. But the budgeting had been for this year, therefore the budgeting has enhanced to 3,200 crores of rupees. Although we see that the ICMR budgetary allocations don't seem to have changed much. Now, the point here I would want to probably bring in is that to ensure infrastructure, which Sandeep ji has just talked about, can we only rely on the increase, which is again not really in that sense vast enough to be able to bring on that infrastructure, and infrastructure in the sense, the holistic sense, where the healthcare personnel are equally of relevance. Now, when we look at the way health education institutions, healthcare provisioning institutions have been lying without personnel for a fairly long duration of point. I may not be able to share the data immediately, but the idea is that something to the tune of the range across the country is something to the tune of 30 to 60%, where we see vacancies in various kinds of, at various kinds of levels of personnel and various kinds of institutions. Now, going by that understanding, I think it becomes very, very important for us to take note of, while the current budget has proposed to spend 83,000 crores, nearly, which is a little more than, I think, last year's budgetary allocation. And that's why perhaps we've been saying that it has increased by 16%. What really becomes, what we really need to think about is, in all of these increase, with no emergency funds being allocated, with the assumption that COVID has kind of started to retreat, where do we put in place the infrastructural realms of the healthcare service provisioning? And I connect this with what Sanjay, Dr. Chazra has just said, Sandeep ji has just said, in terms of the workforce, in terms of the work protocols which need to be put in place if infrastructure, the best of the infrastructure has to be extracted. Now, when we look at the infrastructure in terms of the personnel, in terms of the work environment, keeping in mind the COVID scenarios, some 2 points probably I wish to bring in over here is workers in the hospice centers, which have been which have been at the lower levels of work hierarchy. Say, for example, if I'm talking about the hospices, the ward boys, the workers who engage in cleaning and sanitation, those who were cleaning the bedpans, for example, of the COVID patients. The direct connect with the infection, if I may use the word, has certainly been more to them versus the professionals or the personnel who are located at the higher levels, wherein the direct connect with the wards, with the people who are experiencing the infection has been minimal. So the budget, in fact, even the earlier budgets haven't really talked about this level of workers in the hospice scenarios. The other realm which I want to bring in over here is that of the contractual workers. When we're talking about the personnel in the health sector, as we see the transition from the public to the private care, a lot of workers have been contractualized. And with that realm, the care provisioning has been very, very strongly affected, and therefore the social disparities in access to care itself becomes extremely, extremely important. Because if you look at the out-of-pocket expenditure which is happening in the country today, is something to the tune of 70 to 80%, and all the more when we do have very little. Barely less than 10% of the population who is covered by any kind of health insurance. Of course, insurance has another set of questions that we might want to pose it. So with this kind of spending, healthcare, public spending on healthcare, I think we are ranked among the top 10 countries who are spending minimum on healthcare, and we have to incur a higher out-of-pocket expenditure on health. So I would probably therefore want to bring in my last point that I would want to say in this context. I think it really becomes important to bring in also the other dimension of working women, if I may say, both in the health sector and outside the health sector. Health sector particularly because given the realms in which COVID work has been placed, women have been burdened not only by domestic work, but also by their professional challenges vis-a-vis the arrival of the pandemic. And in this backdrop, I would think that the budget really doesn't talk about how would one take care of the losses which women, in particular working women, at all levels, from the lower waged women workers to the higher professionals have, what are the problems? Although the budget speech does talk about that the care will be taken to the losses which have been incurred due to the pandemic, but how that care will be taken does not really come in very clear terms. And therefore, I would probably want to pose this question and end over there. Is it really right to consider budget as a vision document? Because I would really want budgetary allocations, budgetary outcomes to be something which we have a time frame in which we need to achieve them and look back at them whether we managed to achieve or we haven't managed to achieve. So vision document perhaps is then absolving me of that answer. If I'm not able to achieve what I had aimed to achieve, I'm kind of being absolved because it's a vision. I envisioned it as a state, but I haven't managed to do it. So I think it just leaves me, it just absolves me for that responsibility of being able to do that. So I would want to kind of end. And one more point, perhaps, something which in the tune of bringing in the mental health in some prominent place. I think care for elderly, where the budgetary allocations were something to the tune of more than 100 crores in last year's budget. The expenditure incurred vis-a-vis the revised budget had been cut down to 15 crores. The only, and we don't really, I really couldn't get the sense of what was happening in this form, therefore. The only good thing perhaps, or perhaps in addition that we can probably think is at least that the mention, it does require some kind of mention, even if the telemedicine which has been evolved for mental health can probably be, placed along the same realms, and therefore hopes that something to the tune of this would also be given. So I'm just probably trying to say that some kind of clarity is really important, which seemingly hasn't come up very well when we really look into in between the lines as we try and understand the budget. I'll stop here.
Thank you, Professor Acharya. Now I'll request Professor Panda to reflect back on the one digital initiative which is there in this budget, that is open platform health ecosystem. Will it address by bringing in the health registries of the professionals as well as the health facilities, will it help to bring a kind of in a synchronized manner to know what resources we have, what resources we require, how the geographical allocations of those facilities and resources are there? Will it help us to view our situation where we stand and help plan for the future, that these are the areas where we lack either facilities or healthcare professionals or the resources which we need to invest geographically, as well as Sandeep ji was mentioning time and again, the vulnerable population wise, like in tribal areas, so that they are not only concentrated in the urban areas. Will, how you view this initiative, this new initiative which has been announced in this budget?
Thank you. I think this is a welcome initiative. I would combine both National Digital Health Ecosystem, what you talked about, with National Tele Mental Health Program. Both together will help in providing universal access to health facilities. But of course, there are obstacles and challenges, as you told already. For example, we know about the digital divide, the disadvantaged people, difficult to reach people. So somehow we have to find ways and strategy to include them. Otherwise, they will be immediately excluded. But the idea is an excellent one if implemented well, because India is a vast country with actually a lot of diversity in access to and utilization of health services, geography, topography, and etc., etc. So therefore, in one place, real time, you'll get to know what facilities are available where, and even staying in a very far off places, as we have seen during the COVID-19 time, the very important role played by telemedicine. So I think this is a welcome opportunity, but we need to bridge the gap and take care of or address the digital divide issue so that everyone is included. There should not be any, exclusion. Thank you.
Urvashi, if I can request you to reflect back on what Professor Acharya was saying, that vision document absolves us of monitoring the progress. And you mentioned that there is an outcome document as part of the budget. So could you reflect back on how you work on that document and what has been your experience, whether it is able to measure the success of the program only in terms of the money spent, or also in critical milestones or the output and outcomes in terms of what coverage of the population or what coverage of, means like in population terms, not only in terms of the money.
Yes, so I think there's been an evolution, which I think a lot of countries go through, and it's happened here as well. If we look back several decades, public programs, they operated with smaller budgets. Focus was mostly to measure quantity of outputs that reached beneficiaries while keeping the leakages in check. We had the assessment of the public distribution system and its reform. And that's a classic example of this phase. Then we, entered a phase which there was much more focus on maximizing efficiency of service delivery and value add, for the money that we were spending. And so in the mid 2000s, the country actually launched its first performance or outcome budget. And in that, we actually moved beyond outputs, and we started, holding public schemes accountable to outcome achievement. We also had the second Administrative Reforms Commission report in 2009, which further recommended, that we need to focus much more on how well we are using that money and what we're getting from it, and really making that an integral part of the budgeting process. So I think it's been a whole journey, and over the last few years, we have started, developing this output outcome monitoring framework, as we call it, which actually covers all the central ministries. It covers, all the central sector and centrally sponsored schemes. And in 2021-22, together that accounted for roughly 12 lakh crore, or a little more than 1/3 of the government's total schematic expenditure. So it had a fairly wide coverage as well in this output outcome monitoring framework. And this year again, it was tabled in Parliament. So here basically for, each of these schemes, we, in consultation with the ministries, with the departments, we formulate, what are the outputs, what are the outcomes that we want to track, what should be the targets for every year. And a lot of these targets are actually also then broken down quarterly. And then we do a review of these. This review happens actually, in NITI Aayog itself, we have reviews at the level of the members and the vice chairman. With each of the ministries, each of the departments, we have a review every year to see that, what has been achieved, what has not been achieved. And in many cases, they actually recommend that, certain schemes be discontinued, be merged, or cases where we might need a new scheme. So a lot of those kind of suggestions, recommendations are also made in these meetings to the ministries and to the departments. So I think there's a lot of work still to be done to sort of make this, build on this process, make it much more effective and closely linked to the way we think of our budgets and the outlays and the way we think about our schemes. But I think it's an important mindset shift because, earlier, if we see a lot of the discussions, they would just remain limited to the allocations and, what direction they are going. And that's about it. But now we are at least, starting to ask these questions around, what were the actual outcomes or outputs that were achieved and whether they were in line with the, scheme's intended objectives. So I think it's directionally, it's important that, we are taking this step. But like with most of these, processes within the government, there's a lot of work to be done, ahead. Also in taking it to the level of states, and I keep coming back to states because, as I said, in these sectors, especially, you can hardly have any meaningful conversation, where we don't talk about the states. So I think we also need to take these outcome budgets, and actually many states have their own version of these budgets, which are also quite extensive. Like Delhi comes out with quite an extensive outcome budget. So, many states have been sort of doing similar things, but we need to really institutionalize it within the government system at both the central and the state levels to really be able to, make it a meaningful instrument. So that is something that, we are working towards. Yeah, thank you.
Thank you. Now I'll request Shobha ji to reflect back on something which she was mentioning earlier, that women and children, how important they are. And I'll just give little my view on that last year, there were 6 pillars in the budget, and health and well-being, like as Sandeep ji was also saying that we cannot dissociate these two. When we talk of health, we need to also talk of well-being. And that's the definition of WHO also for the health. It's not just the absence of the disease. It has to be more comprehensive and in terms of well-being. So, but this time there is no, there are only 4 pillars, and there is no pillar on the health. But do you think that the last year when the budget has a comprehensiveness of talking about health and well-being, it also brought in water and sanitation and nutrition, Anganwadi schemes in when they were talking about the health. Do you think that that way of looking at the health has been missing in this budget, or do you see that no, she might not have talked about those things, but still that focus is there?
Yeah, as I said earlier, Devinderji, I mean, the social ground realities have not been kept into mind. And when we also say COVID, I mean, COVID has definitely led to a lot of economic fallout. So, and things like, not only women, I mean, when we say poor access to health, lack of education, employment, or we talk about targeted social welfare schemes and programs, all of them seem to be neglected. And if I specifically talk about gender budget, it's the same as last year, and which was hugely insufficient last year. So now the same this year, again, the same budget has been allocated. And when we talk about women and children, it is just 0.5% of the total budget. I mean, you can imagine what an important sect we are talking about, and the budget allocation is just 0.5% of the total. There have been various programs like social security nets and all, which have all the budgets have been, either stagnant or they have been slightly cut down. I mean, there has been no program where there has been an allocation based on the reality. Now, when we talk about this simple example of Anganwadi centers, when we say we need to, the infrastructure is going to be, upgraded. But, you have to look at the basic what is available. There is no clean drinking water, there's no toilets. And then with no extra financial allocation, how do you expect to have a better upgraded, those few lakhs of Anganwadi centers which are going to be upgraded? And with subsidy cuts, there is going to be a huge setback, whether you talk about the midday meals or you talk about the ICDS supplementary programs. Earlier, we were talking about health personals. I think they have not been given their due. If I just basically talk about some of the community health workers or some of the volunteers, they have not been given due recognition. I mean, they have actually been the COVID warriors. Now, when you talk about remuneration, so much of work happens at their level. But what about remuneration? What about just doing the infrastructure? What about backing up with quality delivery of services? Or you talk about adequate staffing, or you talk about building capacities of these frontline functionaries. I mean, or improving access to healthcare and nutrition services. All these seem to be neglected. And one important aspect, when we were talking about micronutrient deficiencies or anemia, the adolescents have been kind of left out. I mean, there is no separate demarcation in terms of, having any budget allocated for the adolescent schemes. I mean, this is something very important which needs to be kept in mind. When we talk about PDS, it has been a boon, especially in terms of pandemic during when, people were getting the rations, but it is not universal. Only 60% is covered by it. And schemes like, Pradhan Mantri Garib Kalyan Yojana, where the people were getting additional food grains, there seems no indication of extending it. So I think there have been so many realities which have been neglected, which have been kept in mind, and it's imperative for the government to look at sorting this crisis, be it by universalizing the under the NFSA, the PDS, or creating opportunities. Mr. Sandeep was also talking about safe work environment or investment for health and education. I think these things need to be kept in mind when we are looking at when we take it as a reflection of the last year's budget and what more needs to be done. And especially with the pandemic, with an emergency, with a response situation, I think it was all the more important to have a very holistic and a very realistic kind of budget, not just allocating the same amount, looking at what has happened and what is going to happen. I mean, it's not over. COVID is not over. We don't know what else is coming in. So I think that futuristic view has not been kept in mind, and while allocating budgets. So that's an additional point which I would like to add.
Thank you very much. Now we are coming to the end of the panel discussion. So I'll request the panelists to very briefly, like in 1 or 2 minutes maximum, if they think that there is any burning issue which should be brought on the table and which might have been left out.
Okay. So let me speak probably in turn, probably out of turn, but there is a burning issue. I would just want to amplify it for takers in the civil society, those who might be listening, and yourselves, very august panel. And that's the matter which has been mentioned, but I want to amplify that that's the case for all the Anganwadi workers. That's the case for all the frontline workers who worked at huge risk, who we celebrate notionally as maybe in gratitude terms as COVID warriors. They're not only, they haven't, their history is not just of only being having in the last 2 years COVID warriors. They have been carers for a long time. It's just that in COVID, their role was very exposed and well exposed and respected in the public eye. And therefore, I want to make the case for, as Professor Acharya was referring to in her personnel side of the presentation, I want to make the case for compensation, wage compensation during the time of these last 2 years or a cut-off period. I also want to make a case for ensuring dignified wages to all of the people who are our frontline care providers, people who were in crematoriums, people who were cleaning bedpans, people who, what was referred to as ward boys, because there's a disparity there. We never see ward girls, for instance. And I don't want to sort of make a case to make ward girls. I think the fact remains that there is also a huge question there. But all the people who, in some ways, were sanitation workers, crematorium and burial ground workers, people who were attending to COVID and other patients and have been doing so pre-COVID time as well, I want to make a huge case for recognizing them as sustainability, care, and what is called ecological service defenders. And therefore, in addition to dignified, decent wages, assuring that that's a moral, political, and ethical responsibility of the state, in order, apart from ensuring minimum dignified monthly wage, I also want to make a case for ensuring additional 1 month wage as what is called care and frontline defenders wage, because they service the society in ways what Dr. Suri was talking about in a futuristic way. They are the real unsung heroes if we take our health sector in the wider sense of the word. And they are the most precarious workers, and ironically, they are in most precarity. So I think I want to say that. And I also want to say, secondly, that the wage compensation mechanism has been suggested. One can always debate whether Labour Ministry should take the lead on this, or whether Health Ministry should take the lead on it. Without getting into that sort of ministerial or departmental sort of hiatus, this is something that any forthcoming budget, any forthcoming supplementary allocation, any forthcoming public debate on the matter should really put it at the center. Thank you.
Professor Acharya, Professor Panda.
Yeah. Sorry, if I can come in, Dr. Devendra?
Sure, please.
In fact, I would just take further what Sandeep ji has just said. Thank you, Sandeep ji, for bringing in the crematorium workers and burial ground workers. Also, I think in our fray, we almost kind of forgot, but thank you for working. In fact, I'm right now working on a study amongst the sanitation and burial ground and crematorium workers, and rightfully, as you said, they need to be brought in some way vis-a-vis the compensation alongside the decent work part of what we perhaps are trying to put in place. I just want to make 2 points over here in addition to this. I think when we are talking of the larger health realms, I completely agree with Shobhaji when she brings in the realms of adolescent population, and therefore I would want to bring in the demographic realms in understanding the health systems and health outcomes. The assumption being that youth and adolescents are fairly, well equipped in terms of health. A lot of neglect has happened to them, and these are the ones who by way of COVID, indirectly been affected very, very strongly by way of the very system of attaining education, which has changed for them in last 2 years. Going online has been a traumatic experience for most of them by way of the uncertainties that this system has brought in. So that's something, while mental health realms have been put in place, but how it will happen and how will this reach to the school level students is something which is very, very important and has not been at least addressed in any which way. Similarly, for the teachers also, I think it's equally relevant, particularly the school level teachers, wherein the workload has been very, very different. Again, kind of connecting that with the mental health regimes that have been put in place. The other thing which I want to bring on board right now, which has already been alluded in terms of the social realities, if you look at the National Family Health Survey data of the recent round, the NFHS 5, it tells us that the Dalit women live 14.6 years less than the non-Dalit women. And all of this rests upon the nutrition and the health regimes in which these women are located differentially. And therefore, it brings us back to the access to healthcare services, access to food, etc., etc. And it also, the same data is also telling us that the average height of an Indian, I'm sure those of us who've had a look at the data, and there's a paper which has come up in PLOS One, which says that it's in India that the average height has been reducing over last few decades as compared to the increase which is happening in the global scenario. So that again brings us back to the whole idea of the neglect. And in fact, it's telling us the story of the neglect which the health sector has had in last so many years. And therefore, I think it brings us back to the need of data being made available in public sector so that research, if at all the research enhancement has happened, can be done to kind of make some meaningful implications of the scenarios that we have experienced vis-a-vis health in last so many years, particularly last 2 years. Thank you, Dr. Singh.
Thank you. Professor Panda.
Okay, now just some, already we discussed little bit of evidence base and what needs to be done. So if we look at the NFHS 5 data and compare NFHS 4 and NFHS 5, we find the following unfavorable trends in some of the indicators. First, anemia among women and children has increased at the all India level as well as for rural and urban areas. So at the all India level, anemia among women has increased from 53% to 57%. Anemia among children has increased from 59% to 67%. Second, overweight or obesity among women and men has increased again at the all India level and also for rural and urban areas. At the all India level, overweight among women has increased from 21% to 24%, and overweight among men has increased from 19% to 23%. And another indicator, that is waist to hip ratio, of nearly 50% of adults in India falls in the high risk category. So all this point to the revamping and re-strategizing of programs associated with Poshan Abhijan, Poshan 2, Prime Minister's Poshan Shakti Nirman, and Anemia Free India, and adequate resource allocation. So that is one. So in addition, according to me, there is a need to prioritize the following. The first, strengthening health infrastructure in rural and urban areas. That is fundamental. Second, multi-layer and multi-skill human resources for health. Okay. Third, strengthening primary healthcare. And fourth, quality healthcare services. We should focus on quality now. That is fundamental. And all these would require more allocation of resources as well as efficient utilization of resources in the following. Focus on health and wellness center. Excellent idea, comprehensive primary healthcare, but nothing much is happening. We should focus and fast track this. PMJ, and health infrastructure mission. Thank you.
Thank you. Shobhaji,
Um,
any burning
yeah,
idea
while I
remaining?
agree to all the way forward thinking on the budget, but to sum up as to what I've been talking about with due emphasis on for women and children. So I think what is important is the gender budgeting. I mean, gender budgeting, which is cross-cutting, which is multi-sectoral, and it impacts the lives of women and girls, and it is also impactful for economic growth. So I think gender budgeting should be the first thing which needs to be done. And in terms of when we talk about health, nutrition is very integral. So when we say that there have been disruption of nutritional services during the pandemic, so it's very important for the nation to look at how to provide for the needs of the people. So when we talk about food security and the growing food insecurity, so I think the nutrition programs should include more nutrient-dense foods. There has been a big debate on egg, but then wherever socially acceptable, I think high protein and high nutrient-dense food should be added to the diet. Then when I was talking about PDS, I think there should be universalization of PDS, which is very important, or even extension of the PM Garib Kalyan Yojana, so that it will also benefit the ones who are not covered under the PDS or the NFSA, like the migrant workers and the vulnerable communities. And lastly, I think the budget, when in the future budget, I think they should have laid some groundwork for an inclusive and an equitable post-COVID recovery, because I think that is very important, even for the future budgets which are going to be developed, or additional budgets which are going to be formed. I think they should keep in mind where it should be inclusive and it should be equitable. So I think that will be my humble submission.
Thank you very much. Urvashi ji. Urvashi ji, can you hear me?
I think she's not there.
I think she's not there.
She's not there. Okay.
Yeah.
So let's bring it to the conclusion. Thank you very much to all the panelists. We have discussed budget, especially in the context of health, from different angles, and it has been a good learning experience for me, and I'm hopeful all the participants who have joined this panel discussion must have also benefited from rich insights, arguments which were put forth, and the evidence which was given. Briefly, in my comment, I would like to say that if I have to use just one sentence, then I'll call it unpandemic budget in the pandemic times. So, like the budget space provisions made for health and related sectors do not seem to give any impression that we are still amidst a pandemic, which has resulted in loss of countless lives, liberty, and livelihoods. The budget speech, it seems to indicate that pandemic is over, and that the only thing, important thing to do right now is to revive the economy. And it is also thought, like Sandeep ji was saying, that the focus is on trickle-down kind of understanding. It is understood that once the economy is revived, everything else will automatically fall into place. So it also seems to be suggested that the government thinks that the steps they have taken in previous 2 years, such as improved health infrastructure, speed and coverage of vaccination, they have borne the desired results. And because of this, the country has improved capacities already to withstand challenges brought by an epidemic. This epidemic or any future epidemic. That's the sense I got when I was going through the speech and the budget allocation which are there. As I mentioned that in last year's budget, there were 6 pillars. And one of these pillars, the very first pillar, was the health and well-being. And that was heartening for all the people who are associated with the health sector. This time, as I mentioned, there are 4 pillars and health is not one of them. And like the unraveling of public health system during the first and second wave that has been relegated as kind of sideshow, which can take care of itself if the economy is in the pink of the health. As mentioned by all the panelists that private base, it seems that there is 16% increment in the health budget. But if we take the revised budget, the revised estimate as the base, then the increment is only 0.23%. So the total budget coming around to 200,000 crores. Out of which, as was mentioned by Professor Asari, 3,200 crores have been allocated for health research. National Health Mission, surprisingly, the mainstay of health services and programs, has seen almost no change in budget allocation from the last year. Like last year, it was 36,576 crore. This time, it's 37,000 crore. So there is like 300, 400 increment, which could very well be less than the last year allocation in real terms if we take the inflation into account. There has been some increment in the health infrastructure budget from 315 crore to 978 crore. As Sandeep was mentioning, and other panelists also mentioned, that despite large segment of population yet to be fully vaccinated, and there will be requirement for like booster doses, the budget for vaccination has been slashed. What does it imply? Either it will go to the states, or it will be out of pocket expenditure for people. So that does not augur very well, like a budget in times of pandemic times. That's why it's unpandemic kind of budget. As mentioned, nutrition budget has been reduced despite the evidence of rising hunger as well as increasing anemia among the women as well as children. Budget slashed from 11,500 crore to 10,234 crore. Only significant, it was also mentioned by Sandeep ji as well as Professor Panda also, that the digital push which has been given, that is significant in terms of national digital health ecosystem as well as for the network for the mental health. But again, the increase in budgetary allocation for mental health is like what? 14 crore. So like from 597 crore to 610 crore, how the additional initiative will be funded with this much money? Plus, there is a plan to subtract money from other ongoing programs for the mental health. And this is despite the fact that studies have come over without the pandemic, the mental health burden of disease is pretty high in India, requires a sustained kind of program and approach. And during the COVID, especially there has been an increase in the mental health issues of healthcare professionals as well as elderly people, those who are living alone. So this looks like a kind of an easy approach that we announce this scheme, money will not be spent because it's digital. So again, how it pans out needs to be bringing water, sanitation, nutrition in the ambit of health in the last year's budget, as well as commitment to strengthen capacities in surveillance, health research, and public health workforce. That seems to be not addressed, detailed out in this budget. So, like for example, PM Atmanirbhar Swasth Bharat Yojana, that was a plan which was for 6 years. Like 64,000 crore was allocated. So, what is the progress of that scheme? We don't get a very fair idea in this budget, and whether it will be continued, how it will be taken further, where allocation was earmarked, that's still there. So we don't get very good idea of the programs or schemes which were started in last year's budget, how they are moving in this. So what in brief I can say, as also mentioned by different panelists, that in last year's budget, Finance Minister had said that even at the outset, I would like to say that investment on health infrastructure in the budget has increased substantially. Progressively, as institutions absorb more, we shall commit more. So there is no more commitment of any additional funds or more funds. So can we assume that institutions which are there, they have not been strengthened because they were not able to absorb more or demand more? So overall, this budget, as I said in the starting, it looks like a very un-pandemic budget, which is taking place in pandemic times, totally ignoring, as the Shobha ji said, ignoring the realities, as Sandeep ji was mentioning, the epidemiological and demographic diversities which are there in this, ignoring the needs in terms of research evidence, which Professor Acharya was highlighted in her presentation. So this looks like a budget which did not put too much thought on health or other allied social sector, but more geared towards economic recovery, and with the thought that once we are on a economic recovery path, other be able to allocate funds. That is my comment, and I hand over to Arjun.
Yes, thank you. Thank you so much, sir. So to officially propose the vote of thanks, now invite Anshula Mehta. Anshula.
As we come to the end of this extremely important and informative deliberation on population health and Union Budget 2022-23, I, Anshula Mehta, Senior Assistant Director at IMPRI, would like to propose a formal vote of thanks. On behalf of the IMPRI Center for Human Dignity and Development, I thank our distinguished panel for taking out the time to be with us today. We are grateful to Mr. Devinder Singh for chairing the discussion and driving it with his valuable guidance and inputs. Thank you, sir. We thank our panelists, Professor Sanghamitra Acharya, Mr. Sandeep Chachra, Dr. Shobha Suri, Professor Pradeep Panda, and Ms. Urvashi Prasad for joining us and sharing their pertinent analysis, their rich insight and perspectives on the topic. Thank you. And of course, we are grateful to all our participants who joined us here on Zoom as well as on Facebook Live, or would be watching us later on YouTube or listening to us on our podcast. We hope that you continue to tune in to future episodes of Population and Development, as well as our other web policy talks. We also invite you to join us for more of our upcoming discussions on the Union Budget 2022 today and tomorrow. Thank you again, and I wish you all a very good evening.
Thank you very much.
Thank you. Thank you so much.
Thank you.
Thank you so much.
Thank you, ma'am.